So hello, I will be your clinician today, and I just wanted to say that I'm Christy, and it's nice to meet you. I wish we could meet in person, but obviously the circumstances. And I will be taking notes during this time together, but don't worry about it. It's just for my memory and my purposes, but do not worry about when or how or when I'm taking notes, because it's just for me. And what's your name?
Hi, my name is Joe Karev.
Okay. And what's your age and date of birth?
I'm 33 years old. I was born in 1987. I'm not totally sure about the exact date.
Mm-hmm. And so you are female, and what would be your race? How would you describe your race?
Caucasian.
And are you what's your marital status?
I am married.
Okay. And what is your living situation at this moment?
I currently live with my husband.
In a house, apartment, other?
We live in an apartment together.
Okay. Record all this. So the next set of things will be mostly about your family. Where were you born?
I was born in Pittsburgh, but I kind of grew up all over the place. I was in foster care.
Okay. And who raised you?
I would say I really raised myself. I kind of left foster care at 16 and started living out of my car.
Okay. And do you have any siblings or step siblings?
I recently learned I have 2 half siblings.
Oh, okay. And how recently is that?
It was pretty recent, about a week ago.
Was that a shock to you?
Yeah, I went up to Pittsburgh to meet my birth mom, and I found out that she has 2 kids, so that was pretty shocking.
Mm-hmm. And how many times have you don't compare yourself to your siblings because you just met them, or have you met them?
I haven't met them, I just know of them, but it seems like they have a better life than I did. My mother lives with them.
Does that make you feel any certain feelings, or?
Yeah, it's pretty hurtful. I mean, after talking to her, I understand the circumstances around her leaving me, but it's still pretty hurtful.
And how was that conversation with her? Did it go over well? Have you guys come to a good resolution, or is it still undecided?
It was not great. It just made me feel pretty bad.
Hmm. How many times have you been married?
I've been married twice. My first marriage was pretty abusive, but my current marriage is good.
Okay. And do you remember the dates of your marriages?
My first marriage was from around 2010 to 2018, and my current marriage was 2019.
Okay. Do you have any children?
I do not have any children.
And do you have any stepsons or daughters?
No stepsons or daughters.
Okay. So the next thing I will go on to is your educational history. So what is the highest grade that you've completed?
I'm currently a doctor, so I went to med school. I went to Princeton for undergrad and then Harvard Medical School.
Okay. Did you ever leave school at any point, or?
No.
No. And do you like school?
I would say I like school. I was able to work really hard to make a better life for myself.
Mm-hmm. You seemed a little bit unsure at that point. Did you just, can you explain that to me?
Yeah, I guess it was pretty difficult since I was living out of my car for a while, but it really helped me better myself, so I guess school was good for me.
Okay. Did you ever, do you ever fail a grade? And what were your grades like?
No, I had really good grades. I was valedictorian of my high school and top of my class at Harvard.
So you were never part of special education?
No.
Okay. And did you ever get in trouble at school with behavioral
I had a
issues?
few issues here and there. Just I would get into fights if kids ever gave me trouble for, practically being homeless and that sort of thing.
Mm-hmm. Were you ever suspended over these behavioral outbursts?
No, it was never anything serious.
Okay. Okay, so the next thing, talk about your employment history. How many jobs have you had?
In high school, I worked at a restaurant for a while just to have some money. But apart from that, I've just been a doctor since med school.
And what is the longest you've ever had a job?
I would say this job at the hospital has been about 10 years, maybe.
Okay. Do you respond well to your peers where you work, your bosses and such?
I would say so. I mean, all my coworkers are my friends, so we have a good relationship.
Okay. Have you ever been fired from a job?
No.
Do you currently handle your personal finances?
Yes. Me and my husband deal with our finances together.
Okay. Do you have any problems with handling your money?
No.
Next, I'll ask you about, do you have any military history?
No.
Uh, and then medical history. Are you aware of any complications during your birth?
Not that I'm aware of, no.
And do you know anything about your development? Were you hitting the right, stepping stones at the right times? Were you crawling at the right time?
I think so, but I was in foster care and I moved around a lot, so
Mm-hmm.
I'm not sure, but I think so.
Have you ever suffered from a head injury or loss of consciousness?
No.
Are you currently being treated for any physical illnesses or injuries?
No.
And are you taking any medications at this time?
Not right now.
Have you ever suffered from seizures?
Nope.
No. Or blackout?
No.
No. Okay. Is there any additional information that you think I should know about your medical history?
No, I don't. Nothing serious, no.
So you have mentioned that your first marriage was problematic and that he abused you, and that is the next thing I want to ask about. Um, so you have been what kind of abuse was it?
He was physically and emotionally abusive.
Never sexually or
No,
okay. And how did that physical or emotional abuse play out?
he would just hit me, or he would make me feel like he was in control of me.
Hmm.
But I was able to leave him a few years ago, and it wasn't till 2018 when he died that I found him again.
And was his death your sense of freedom, or did your sense of freedom come before that? Did you talk it out with him before he died?
I was very scared up until his death, just
Hmm.
because I did leave him, so I was always scared he would find me.
Hmm.
Um, so when he died, he was actually in a coma for some time, and I realized that I was still legally married to him, so it was kind of my decision what to do with him.
Um, and how did the emotional abuse, like what did he do?
He was just very controlling. He wouldn't let me see anybody, have friends. It was just me and him a lot.
And so the next thing, I thank you for explaining all this to me. I'm just trying to go through the, you know, understand your situation. The next thing I'm going to ask about is your substance use history. Have you ever do you how do you drink,
Yes, I do.
and when has that started, or how often do you drink?
A few years ago, probably, I started like around when I turned 21, typical. But I've been drinking pretty frequently now, just after I talked to my birth mother. I haven't been doing really well, so I've been drinking a lot more, but no drugs or anything.
And how many drinks would you say a day?
I'd say a couple, um, sometimes a bottle of wine or something.
When was the last time you drank?
Pretty recently, my friends and family are concerned, so that's kind of why they brought me to therapy.
Have there been any problems with your behavior because of drinking?
I guess so. I'm not really going to work. I just want to be home.
Mm.
And me and my husband are not doing well right now.
Okay. And why would you say that your husband and you are not doing well right now?
I just want to be alone right now. Um, and he's trying to take care of me, but I kind of want to be alone.
Gotcha. And when's the longest time you've abstained from drinking?
I would say before this, it was like a month. I would only occasionally drink with friends or something.
Okay. Do you ever use cigarettes,
No,
marijuana,
no,
cocaine,
no,
opioids,
no,
hallucinogens,
no,
um, amphetamines,
mm,
sedative or hypotonics,
no,
and any other sort of substances?
no,
Okay. Have you had any substance-related problems? We've already covered some maybe behavioral things like you not wanting to go to work, but have you had any legal problems?
no, I wouldn't say so.
And your family and friends are concerned about you?
Yes.
In what manner?
Um, they just keep checking up on me because I don't, like I said, I just want to stay home and I haven't been going to work. They
Mhm,
don't really know what brought this on, but I don't really want to talk to them about it.
mhm. Do you ever act out when you're drinking?
Um, I wouldn't say so, no.
Okay. Have you ever had blackouts because of the amount you drank?
No, I mean, I just kind of stay in bed all day and drink, so
Okay.
not really.
And do you ever feel like when you don't have the drink, do you feel withdrawal?
A little bit, but I'm just kind of using it to make myself feel better right now.
Okay. Um, do you have any current? So the next section is legal history, and do you have any current charges against you
No,
or a past criminal record?
no,
Okay. The next thing I'm going to ask is mental health. Do you have a family history of mental illness?
I'm not really sure, but I think my mother might have suffered from depression for a little bit.
So, sorry, can you repeat that again? You're not really sure?
Yes. Yeah, I'm not really sure, but my mother had some anxiety and maybe some depression.
Okay. And so now we'll talk about you. How would you describe your mood generally?
Pretty lately, I've just been feeling kind of numb. Like I don't really want to do anything. I just want to be in bed. And I'm not even going to work. I don't want to see anybody.
Have you seen that affecting your relationships with friends and family?
Yeah, like I said, me and my husband aren't doing well right now. He's very concerned about me, but I just don't want to talk to him.
Do you have any suicidal ideation?
No,
Are you anxious, stressed, or worried?
yeah, I would say so. I'm just anxious about,
Hmm.
I guess, my situation currently.
And why would you say you're anxious? What triggers it?
I mean, I just know that like I'm in a bad place right now, but I don't really know what to do about it.
Hmm. Do you have any irritability?
Yeah, I guess I'm pretty irritated at my husband, so I don't want to see him.
Mhm. And is it because of him or because of a outside factor?
It's outside factors. He's just trying to help, but I just don't want to.
Do you have problems sleeping?
Yeah, I do.
Okay. And what occurs at that time that you want to lie down and you want to relax, but you can't?
Yeah, I feel like I have a lot of thoughts running through my mind, so it's difficult to sleep sometimes.
Do you have delusions ever?
No,
Hallucin- hallucinations?
no,
Okay. Or any other thing that I should know about?
I don't think so.
Okay. Were you ever diagnosed with something?
No.
And what would you say has brought you here?
I'd say I guess my friends and family, my husband specifically, he's seen how bad I've been this last week since returning from my trip. So he pushed me to come to therapy.
Hmm. Did you want to come to therapy, or was it more of your friends and family pushing you?
I didn't really want to come, but I know it's probably for the best for me to talk
Hmm.
this out with somebody.
Did you have any previous psychological testing?
No,
No. Treatment for mental health, inpatient or outpatient before now?
no, no,
Are you taking any psychiatric medications at this time? Okay.
not right now, no.
Okay. So now we're moving on to daily activities. How do you spend your typical day?
I work at a hospital, so I spend most of my time there.
Mhm. And at the hospital, are you mainly on your feet moving around or sitting in the office?
I move around a lot. Sometimes I do research.
Do you ever have time to, when you come home, to go out and do exercise or other hobby-like activities?
Um, I like to get dinner with my friends, and we like to do gatherings of the sort.
Okay. And so do you do anything else that is like for fun?
I really enjoy research. I know it's technically a part of my job, but it's something I personally enjoy.
Hmm. Have you noticed any kind of deterioration in your personal care recently?
I'd say so. I haven't really left my bed, so personal care hasn't been the best. I'm just not interested in doing things or interacting with people.
How was it like in the past?
It was fine in the past. I used to take care of myself, go to the hospital, see my friends, but not right now.
Do you feel less inclined to take part in those activities that you enjoy?
I would say so.
Do you have, of course, you spoke about your husband, but do you have any other impaired ability to interact with others?
Yes, I just haven't seen any of my friends in a while. I don't really want to see them.
Mhm. And have your friends ever like come up to you and say like, "What are you? Where are you? Are they missing you?" And
Yeah, I had a friend come visit me, and I didn't really want to see him, but he stayed with me for a little bit.
okay. Do you have impaired ability to understand, remember, or carry out information that you're given?
I would say so.
And what do you think? Why do you think that is?
I guess just I'm having trouble focusing. I'm lost in my thoughts.
Hmm. Okay, so we're wrapping up. The end is near. Don't you worry. Um, the last part will be about your social history. And you've told me a little bit about your husband and your social life with friends. But is there anything about your social life that I have not heard that you would like to explain?
I guess just usually it's good, my coworkers, they're like my friends since I spend most of my time at the hospital. Um, but I do tend to isolate myself after an argument. So I would say that's what I'm currently doing.
Mhm. Has this always been part of your temperament or isolating yourself, or is that a new thing?
I would say it's always been a thing since I've kind of been alone for a lot of my life. So I'm just used to kind of relying on myself.
Are you afraid of attachment?
I would say so, yeah. When I first started dating my husband, it was kind of difficult to trust him, especially after my first marriage.
Mm-hmm. So did you have any romantic relationships before your husband's or during the time of finding each husband?
Yeah, I had a couple in high school, but I would just kind of leave them because I knew that it wouldn't work out.
Mm-hmm. And can you further explain your current relationship with your husband? Like, how did you guys? Did
Yeah,
he find you when you were hurting? I guess.
yeah. Well, he works at the same hospital I do,
Mm,
and we just became friends.
okay.
That developed further.
Do you think that the since he works so closely to you, do you think that that tension leads into your personal life with him?
Yeah, it's definitely. I mean, if we don't see each other at work, it's
Mhm.
okay. But sometimes if we're like fighting, it's difficult working together.
And how do you handle an argument with your husband or family member or friends?
I just, like I said earlier, I just kind of tend to isolate myself. Kind of what I'm doing right now.
Have you ever become violent at any points?
No.
The last thing I think, do you have any additional information or follow-up questions on this meeting that you would like to ask?
I don't think so. I think just, like I said earlier, I think my mental health has been troubled just since the visit with my mother. Since that was not good, I think that's kind of what led me here.
And you would say that was the start of these symptoms, or?
I would say so, yes. I was doing pretty well before this.
Okay. Well, thank you very much. It has been quite enjoyable, and I appreciate you opening up to me and being honest, even though you did not really want to come into therapy, but I'm glad you took this opportunity too. And we'll get back to you with your results.
All right,